Imagine waking up months from now and still dealing with the same frustrating problems you hoped would disappear. That constant urine leakage after you finish using the bathroom. That feeling that your bladder never fully empties. Or the worry that your erections are not as strong as they used to be. For many men, these issues don't simply disappear on their own. They can slowly start affecting confidence, relationships, and the way you feel about your own body. And if you are like most men, you have probably searched everywhere for answers. You may have tried different exercises. You may have followed advice from the internet. You may have even spoken with a healthcare professional and been told to simply strengthen your pelvic floor. But here is where many men make a mistake. They focus only on getting back to what they consider normal. The real goal should be restoring proper function, because your pelvic floor muscles are not just about strength. They are about balance. They need to be strong enough to support your bladder and sexual function, but they also need to know how to relax properly. And that is the part many people completely miss. In today's video, I'm going to walk you through the 3 most effective pelvic floor exercises that I recommend for men who want to improve control, reduce unwanted leakage, and support better sexual function. These exercises are designed to help you both strengthen and relax the pelvic floor so these muscles can actually do their job the way they were designed to. Now, you may have heard someone tell you that the answer is holding a pelvic floor contraction for 20 seconds or longer. Maybe you were told to perform dozens and dozens of repetitions every single day. But I want you to understand something important. That approach is not always correct. In fact, for some men, constantly squeezing and overtraining these muscles can actually make symptoms worse. A pelvic floor that is constantly tight and unable to relax can contribute to problems like urinary dribbling, discomfort, erectile difficulties, and even issues with controlling ejaculation. The goal is not to constantly tighten these muscles. The goal is to teach them when to activate and when to release. That is why my approach is slightly different. The method I'm going to show you today focuses on quality over quantity, proper technique, proper breathing, and making sure you are actually feeling the correct muscles working. Because if you are performing these exercises incorrectly, you are not creating progress. You may actually be reinforcing the wrong patterns. So let's begin with the first exercise. The first exercise is the Kegel exercise. Now, before you start, I want you to focus on your positioning because this makes a big difference. For beginners, the easiest way to learn a proper pelvic floor contraction is by lying down. You can do this on the floor, on a yoga mat, or even on your bed. Find a comfortable position where your body can relax. Lie on your back and bend your knees so your feet are flat on the ground. Your knees should be relaxed and slightly apart. Once you are in position, I want you to take 2 fingers, your index finger and your middle finger. Place them gently on the area between your scrotum and your anus. This area is called the perineum. Some people refer to it as the taint. This is the exact area where you should be able to feel your pelvic floor muscles moving. The reason I want you to place your fingers here is simple. You need feedback. You need to know whether you are actually contracting the correct muscles. Many men think they are doing a Kegel exercise, but instead they are tightening their stomach, their buttocks, or their thighs. That is not what we want. Now take your other hand and place it over your stomach. This is going to help you monitor your abdominal muscles. Your stomach should stay relaxed. Your buttocks should stay relaxed. Your legs should stay relaxed. The only movement you are looking for is deep inside the pelvic floor. Now close your eyes. Take a slow breath in through your nose. Allow the air to completely fill your lungs. Then slowly breathe out. Once all of the air has left your lungs, imagine that you are standing in front of a urinal and you are trying to stop the flow of urine. That is the exact sensation we are looking for. You are gently lifting and tightening those pelvic floor muscles. Then you release. Relax completely. Let's repeat that. Take a deep breath in. Slowly breathe everything out. At the end of your exhale, gently contract the pelvic floor as if you are stopping urine flow. Hold for a moment, then let everything relax. When you perform this correctly, the two fingers resting over your perineum should feel a slight movement. You should notice the skin and tissue underneath your fingers gently tightening and lifting. Then, when you release, that tension should disappear. That small movement tells you that you are activating the right muscles. This is why feeling the contraction is so important. You are building awareness. You are teaching your brain how to communicate with these muscles again. And remember, this should never feel like you are forcing or straining. A proper pelvic floor contraction is controlled and gentle. It is not about squeezing as hard as possible. It is about precision. Now here is an important tip. Keep your eyes closed while practicing this exercise, especially when you are first learning. Removing distractions helps you focus on the internal sensation. And I recommend starting in the lying position because gravity is working in your favor. Your pelvic floor muscles do not have to fight against your body weight as much compared to sitting or standing. Once you become more advanced, you can progress to those positions. But at the beginning, lying down gives you the best opportunity to feel the correct movement. Now, let's talk about something that causes a lot of confusion. How long should you actually hold a pelvic floor contraction? The answer is not 20 seconds. Your pelvic floor muscles are designed to work automatically throughout your daily life. When they become stronger and better coordinated, they should support you without you constantly thinking about them. You do not walk around all day consciously tightening your pelvic floor. Your body should handle that naturally. So when you are starting out, I recommend keeping contractions short and controlled. If you are completely new to Kegels, or you are unsure whether you are doing them correctly, begin with simple contractions. Think of it as an on and off movement. Turn the muscle on, then turn it off. That is it. Start with 10 repetitions. Do this 3 times per day. Once in the morning, once around lunchtime, and once before bed. That gives you 30 quality repetitions throughout the day. And for most beginners, that is more than enough. The biggest mistake I see men make is thinking that more is always better. But muscles do not improve simply because you overload them constantly. They improve when you train them correctly and allow them time to recover. If you overwork your pelvic floor, these muscles can become too active. And when they are too tight, symptoms such as urine dribbling, erectile problems, pelvic discomfort, or premature ejaculation can become more difficult to manage. So remember, the goal is balance. Strength when you need it. Relaxation when you need it. In the next part, we are going to move into another powerful technique that many men overlook. It involves using a simple tool that can help release tension around the pelvis and allow these muscles to function better. This technique is especially useful for men who sit for long periods, train heavily in the gym, or carry a lot of tension in their hips and pelvic region. Now that you understand how to properly activate your pelvic floor muscles, the next step is learning something equally important that many men completely ignore. You need to learn how to release tension. Because a pelvic floor that is only strong but never relaxed is not a healthy pelvic floor. Think about any other muscle in your body. If you constantly kept your biceps contracted all day long, eventually that muscle would become exhausted, stiff, and uncomfortable. The same principle applies to the muscles around your pelvis. They need the ability to tighten when necessary and fully relax afterward. And this brings us to the second exercise. One of my favorite tools for releasing pelvic tension is something very simple. A tennis ball. Now, I know what you might be thinking. Where exactly are we going to use this tennis ball? And before I explain, let me make something very clear. We are keeping this completely safe and appropriate. The goal is not to place the ball anywhere it does not belong. We are going to use it on the muscles around your pelvis to help reduce tightness and improve mobility. The first area we are going to target is your glute muscles. Your glutes play a much bigger role in pelvic health than most people realize. The muscles around your hips, buttocks, and pelvic floor all work together. They share connections and influence each other. So when your glutes become tight and restricted, your pelvic floor can often become affected as well. This is especially common in men who spend many hours sitting every day. Maybe you work at a desk. Maybe you drive for long periods. Maybe your lifestyle involves a lot of sitting. Or maybe you train hard in the gym and create a lot of tension around your hips. All of these things can contribute to stiffness in this region. So here is how you perform this release. First, find a firm chair. A kitchen chair works perfectly. You do not want something too soft because you need enough pressure to reach the deeper muscles. Take your tennis ball and place it underneath one side of your glute. The ball should sit directly into the muscle tissue of your buttock, not on your spine, not on your tailbone, just into the soft tissue of your glute. Now place one ankle over the opposite knee. This position helps open up the hip and allows the ball to reach deeper into the muscle. From here, gently move your body around. You are not trying to aggressively smash the muscle. You are slowly searching for areas that feel tight or restricted. Once you find a sensitive area, stay there. Set a timer for around 30 seconds. Then simply breathe. Allow the muscle to relax into the pressure. The sensation should feel like a deep massage. You should notice some discomfort, but it should never feel sharp or painful. There is a big difference between releasing tension and causing irritation. Remember, the goal is to calm the nervous system and help the muscles let go. After 30 seconds, remove the ball and switch sides. Repeat the same process on the opposite glute. Again, place the ball underneath the muscle. Cross your leg over. Move slowly. Find the areas that feel restricted. Then hold and breathe. Now, if you notice that your glutes feel extremely tight during this exercise, pay attention. That may be a sign that the muscles around your pelvis are also carrying extra tension. The reason is simple. Your glute muscles and pelvic floor muscles connect through the same general region. When one area becomes tight, another area often compensates. This is why pelvic health is not only about doing contractions. Sometimes the missing piece is learning how to release the muscles that are holding too much tension. Once you complete both sides of the glute release, we can move into a more advanced technique. This is where we target the perineum area. Now I want you to pay close attention because this is an area where technique matters. The perineum is the small area of skin between your scrotum and anus. This region contains important muscles that are part of your pelvic floor. The purpose of this technique is to gently provide pressure and encourage relaxation. It is not about forcing anything. It is not about creating pain. It is about helping these muscles understand that they are allowed to release. For this exercise, I recommend using a chair with armrests if possible. The reason is control. You want to be able to lower yourself slowly and adjust the amount of pressure. Take your tennis ball and place it on the seat of the chair. Position it underneath the center area of the pelvic floor region. Use your arms to support your body weight. Slowly lower yourself down. You should feel pressure. You should feel that something is happening, but it should not feel painful. The tissues in this area are sensitive, so control is extremely important. Take your time. Do not rush into the movement. Once you find a comfortable position, begin breathing slowly. Relax your stomach. Relax your hips. Relax your pelvic muscles. Set a timer for approximately 30 seconds. During that time, focus on letting the muscles soften. You can gently adjust your position forward or backward to find the area where you feel the most tension. Remember, You are not trying to force a stretch. You are allowing your body to gradually release. Your arms are there to control the pressure. If it feels too intense, lift yourself slightly. If it feels comfortable, you can allow a little more pressure. But again, discomfort is acceptable. Pain is not. A common mistake men make with pelvic floor exercises is that they think everything has to be aggressive. They believe harder means better. But with these muscles, that is usually not the case. The pelvic floor responds very well to controlled movements, awareness, breathing, and consistency. After 30 seconds, slowly come off the ball. Do not rush. Give your body a moment to adjust. Then repeat the same process as a complete cycle. One side of the glute, the other side of the glute, then the perineum release. This entire routine can be incredibly helpful for reducing built-up tension. Now, how often should you perform this tennis ball release? You do not need to do it every single day. In fact, for most men, 3 to 4 times per week is enough. Especially if you have a job where you sit for long periods, or if you train regularly and notice tightness around your hips. The goal is not to constantly work on these muscles. The goal is to maintain a healthy balance. Strengthen when needed. Relax when needed. That combination is what allows your pelvic floor to function properly. And remember, many men focus only on strengthening because they assume weakness is the only problem. But sometimes the problem is not weakness. Sometimes the problem is that the muscles are tense, overactive, and unable to fully relax. That is why a complete approach includes both activation and release. Now that we have covered strengthening and releasing tension, we are ready to move into the third exercise. This final movement is one of my favorite pelvic floor stretches, and it is one that I recommend to many of my clients. It is called the happy baby stretch. But there is one important thing you need to know. Most men perform this stretch incorrectly. They get into the position, but they never actually create the stretch where they need it most. They miss the deep pelvic floor and hip opening benefits completely. So in the next part, I will show you exactly how to perform the happy baby stretch correctly and how to build it into a simple daily routine for better pelvic health. Now we are moving into the third exercise, and this is one that I personally consider one of the most valuable stretches for improving pelvic floor relaxation. It is called the happy baby stretch. You may have seen this stretch before. It is common in yoga and mobility routines. But here is the important thing. Many people perform it incorrectly. They get into the position, they move around, and they think they are getting the full benefit. But in reality, they are missing the exact area we are trying to target. The goal is not just to make your hips move. The goal is to create a gentle opening through the pelvic floor, the inner thighs, and the deep muscles around your hips. So I want you to pay close attention to the setup. This exercise is simple, but small details make a huge difference. Now, you do not have to perform this exercise immediately while watching. If you do not have enough space or privacy right now, that is completely fine. Save this routine and come back to it when you are ready. You can perform this stretch on the floor. You can do it on your bed. You can even do it on a comfortable couch if you have enough room. Start by lying flat on your back. Relax your shoulders. Let your spine settle into the surface underneath you. Then bring your knees upward toward your chest. Your feet should point toward the ceiling. From this position, reach your arms between your legs and grab the outside edges of your feet. Now, this is where many people make their first mistake. They simply grab their feet and stay in a narrow position. Their knees remain close together. But that is not the position we are looking for. The key is creating width. Using your arms, gently guide your knees outward. Your feet should move wider apart, approximately around shoulder width. This wider position is what allows you to access the deeper muscles of the groin and pelvic region. When your knees open, you should begin to feel a stretch through your inner thighs. You may also notice a gentle sensation around the perineum and pelvic floor area. That is exactly where we want the stretch. Now, remember something important. A stretch should never feel painful. You are not trying to force your body into a position it is not ready for. If you are new to this movement, this position may already be enough. Stay there. Breathe. Allow your body to become comfortable. Your goal is relaxation, not intensity. Many men have spent years holding tension in this area without realizing it. The hips become stiff, the groin becomes tight, the pelvic floor becomes guarded. So, when you perform this stretch, you are giving your body permission to release. For most beginners, I recommend holding this position for 2 rounds of around 40 seconds. A simple way to do this is by using your phone timer. Set it for 45 seconds. The extra few seconds give you time to slowly get into position. Then you can hold the actual stretch for around 40 seconds. During the hold, focus on breathing naturally. Do not hold your breath. This is extremely important. Your nervous system responds to breathing. When you breathe slowly and calmly, your body receives the signal that it is safe to relax. That allows the pelvic floor muscles to let go. Now, once this stretch becomes easier, you can gradually progress it. But you need to be careful. Do not rush. The inner thigh and groin muscles can become irritated if you push too aggressively. To progress the movement, maintain the same wide knee position. Keep your feet separated. Then gently use your arms to bring your feet slightly downward toward the floor. The movement should be slow and controlled. Do not pull hard. Do not force your knees lower than they naturally want to go. You are looking for a comfortable stretch, not a battle with your body. As you lower, you should feel more of a stretch through the groin, hips, and pelvic region. Again, breathe. Relax. Allow the muscles to gradually adapt. One mistake I see frequently is people resisting the stretch. They create tension because they are uncomfortable. But remember, the purpose of this exercise is to teach your body how to release. So instead of fighting the sensation, focus on softening into it. Let your hips relax. Let your stomach relax. Let your pelvic floor relax. Keep your feet apart. Keep your breathing steady. Hold the position. Then slowly release. That is the happy baby stretch performed correctly. Now, let's talk about how all of these exercises work together. Because this is where many men misunderstand pelvic floor training. They think the answer is simply doing more contractions, more squeezing, more repetitions. But a healthy pelvic floor requires a complete approach. You need strength, you need mobility, and you need relaxation. The Kegel exercise helps you build control and awareness. The tennis ball release helps reduce unnecessary tension. And the happy baby stretch helps improve flexibility and relaxation throughout the pelvic region. These 3 techniques work together because they address different parts of the problem. Many men who struggle with pelvic issues are not dealing with just one thing. Sometimes the muscles are weak. Sometimes they are too tight. Sometimes they are not communicating properly with the nervous system. That is why doing random exercises without understanding the purpose behind them often leads to frustration. You need a balanced routine. You need to know when to activate. You need to know when to relax. And you need to progress gradually. Now let me give you an example of what a simple daily routine can look like. In the morning, start with your pelvic floor contractions. Perform 10 controlled repetitions. Remember, we are not holding for extremely long periods. We are focusing on proper activation. Turn the muscle on, then allow it to completely relax. At lunchtime, repeat another 10 repetitions. This gives you another opportunity to practice control. Then before bed, perform your final 10 repetitions while lying down. This creates a total of 30 quality contractions throughout the day. After that, add your happy baby stretch before sleeping. Perform 2 rounds. Hold each stretch for around 40 seconds. This is a great time to do it because your body is already preparing for rest. The goal is to calm the muscles and allow the pelvic floor to enter a more relaxed state. Then, several times per week, add the tennis ball release. 3 to 4 sessions per week is usually enough for many men. You do not need to aggressively work on these muscles every day. Remember, balance is the key. Too little activity can create weakness. Too much activity can create tension. The right approach is training these muscles the same way you would train any other important system in your body. With consistency, with control, and with proper recovery. Now, before you move forward and start practicing these exercises, there is one final piece that many men overlook: progression. Because knowing the exercises is only the beginning. The real results come from knowing how to safely progress them over time. In the next part, I'll explain how to build these exercises step by step, how to avoid common mistakes, and how to create a routine that continues improving instead of causing more frustration. Now that you understand the 3 key exercises and why each one plays an important role, we need to talk about something that can make or break your results: progression. Because learning a few pelvic floor exercises is only the first step. The real transformation happens when you know how to gradually improve your routine without overloading your muscles or creating unnecessary tension. This is where many men struggle. They start with good intentions. They hear that pelvic floor exercises can help with bladder control, confidence, and sexual function, so they immediately begin doing as many repetitions as possible. They squeeze harder. They hold longer. They repeat the exercises over and over throughout the day. But the pelvic floor does not work like that. More effort does not always equal better results. Your pelvic floor is a group of muscles that needs coordination. It needs timing. It needs the ability to contract when required and relax when required. Think about an athlete. A professional athlete is not successful because they are constantly using maximum effort. They are successful because they know exactly when to apply power and when to recover. Your pelvic floor works in a similar way. The goal is not to keep these muscles switched on all day. The goal is to train them to respond correctly when your body needs them. That is why progression should be slow and intentional. When you first begin, your main focus should not be increasing the number of repetitions. Your main focus should be improving your awareness. Can you feel the correct muscles? Can you contract without tightening your stomach? Can you avoid squeezing your glutes? Can you fully relax after each contraction? Those questions are far more important than simply counting repetitions. A perfect contraction performed 10 times is much more valuable than 100 poorly performed contractions. Quality always comes first. As your control improves, then you can gradually challenge yourself. You may begin by increasing the duration of your contractions slightly. But remember, this does not mean holding for extremely long periods. You are training control, not endurance, for the sake of endurance. Your pelvic floor muscles should be able to activate and then return to a relaxed state. That relaxation phase is just as important as the contraction itself. Many men forget this. They become focused only on squeezing. But a muscle that never learns how to relax can become irritated and overactive. And that can create its own set of problems. This is why the routine I recommend combines strengthening exercises with relaxation techniques. The Kegel contractions teach activation. The tennis ball release helps reduce unnecessary tension. The happy baby stretch improves mobility and relaxation. Together, they create a balanced approach. Now, I want to talk about something else that is extremely important: consistency. A lot of men expect immediate changes after a few days. They perform the exercises once or twice and then wonder why they are not seeing results. But your pelvic floor muscles, just like any other muscle group, need time to adapt. You did not build strength in your arms or legs overnight. You did not improve your flexibility after one stretching session. Your pelvic floor works the same way. It requires repetition and patience. The good news is that you do not need to spend hours every day doing these exercises. In fact, that is not the goal. A few minutes of focused practice done consistently can be much more effective than long sessions performed incorrectly. The routine should fit into your lifestyle. You should be able to maintain it. Because the best exercise program is not the one that looks impressive. It is the one you can actually follow. Now, I know many men watching this may be wondering, how long will it take before I notice changes? The answer depends on many factors. Every person is different. Your starting point, your muscle control, your habits, and your consistency all play a role. Some men notice improvements in awareness and control relatively quickly. For others, it may take longer. The important thing is not comparing your progress to someone else. Your body has its own timeline. Focus on doing the exercises correctly. Focus on building better communication between your brain and your pelvic floor. That is where lasting improvement comes from. Another important factor is your daily habits. Your pelvic floor does not exist separately from the rest of your body. Your posture, breathing patterns, activity level, and stress levels can all influence how these muscles behave. For example, sitting for long periods can increase stiffness around your hips and pelvis. Poor breathing habits can create unnecessary tension. High stress can cause your body to hold tension without you even realizing it. That is why improving pelvic health is not just about one exercise. It is about understanding how your entire body works together. Now, I also want to address a common question. Should every man be doing pelvic floor exercises? The answer is that every man can benefit from understanding these muscles. They are involved in bladder control, core stability, and sexual function. But the approach should always be personalized. Some men need more strengthening. Some men need more relaxation. Some men need a combination of both. That is why paying attention to your own body is so important. If an exercise causes pain, discomfort, or worsening symptoms, that is a sign to reassess your technique. Exercise should help your body. It should not create new problems. And this is exactly why I created my structured pelvic floor program for men. Because one of the biggest challenges I noticed was that men had information, but they lacked a clear plan. They knew they needed to exercise, they knew their pelvic health mattered, but they did not know exactly what to do. How many repetitions? When should they stretch? When should they focus on relaxation? How should they progress? Without a clear structure, many men end up guessing. And guessing is where mistakes happen. A proper program removes that confusion. It gives you a step-by-step system that combines contractions, stretching, relaxation, and progression in the correct order. It is designed specifically for men who want a simple plan they can follow consistently. The goal is not to overwhelm you with dozens of complicated exercises. The goal is to give you the right tools and help you use them correctly. Because when it comes to pelvic health, the details matter. Small changes in technique can create completely different results. That is why education is so important. You need to understand what you are doing and why you are doing it. When you have that understanding, you can take control of your own progress. In the next and final part, I'll walk you through the complete routine, explain exactly how to put everything together, and share the next steps if you want more structured guidance and support. Because at the end of the day, knowing the exercises is helpful, but having a clear plan is what creates consistency. And consistency is what creates results. Your pelvic floor muscles are just like any other important system in your body. They need the right amount of challenge. They need recovery. And they need proper guidance. So let's review what an ideal routine can look like. Start your day with your pelvic floor contractions. Perform 10 controlled repetitions in the morning. Remember the key points. Do not rush. Do not squeeze as hard as possible. Do not tighten your stomach or your buttocks. Focus on a smooth contraction. Feel the muscle activate. Then allow it to fully relax. That relaxation between each repetition is just as important as the contraction itself. Later in the day, repeat another 10 repetitions. This gives your brain another opportunity to practice communicating with these muscles. Then at night, before going to sleep, complete your final 10 repetitions while lying comfortably in bed. This gives you a total of 30 quality contractions throughout the day. And for most men, this is a much better approach than performing hundreds of random repetitions without proper technique. Remember, your goal is not to exhaust the muscle. Your goal is to train control. After your evening contractions, add the happy baby stretch. Perform 2 rounds. Hold each stretch for around 40 seconds. Use your breathing to help your body relax. Allow your hips, groin, and pelvic floor muscles to gradually release. This is a great time to perform this stretch because your body is naturally preparing for rest. You are helping your nervous system shift into a more relaxed state. Then, several times throughout the week, include your tennis ball release. Around 3 to 4 times per week is a good starting point for many men. Focus on the glutes first. Release the areas around your hips and pelvis where tension commonly builds. Then, if appropriate and comfortable for you, continue with the gentle perineum release technique. Again, the purpose is not to create pain. The purpose is to help your muscles let go of unnecessary tension. This complete routine creates balance. You are strengthening the muscles that need more support. You are relaxing the muscles that are holding too much tension, and you are improving the connection between your brain and your pelvic floor. Now, I want to talk about the importance of having a proper progression plan. Because one of the biggest mistakes men make is doing random exercises without knowing what comes next. They do a few contractions. They try a stretch. They search for another exercise online. Then they wonder why they are not making consistent progress. The problem is not that they are unwilling to improve. The problem is that they do not have a structured system. That is exactly why I created my 8-week pelvic floor blueprint specifically for men. The purpose of this program is to remove all the confusion. You should not have to guess which exercises to perform. You should not have to wonder how many repetitions are enough. You should not have to figure out when to stretch and when to focus on relaxation. Everything is organized step by step. The program combines pelvic floor strengthening, mobility exercises, relaxation techniques, and proper progression. It gives you a clear routine to follow each day for 8 weeks. You can access it directly on your device. You can save it digitally. Or you can print it out and keep it somewhere visible as a reminder. Think of it like having a personal roadmap for your pelvic floor. Instead of trying random methods and hoping something works, you have a structured approach that guides you through every stage. Now, I always remind men of one important thing. Your health journey is personal. There is no single exercise that magically fixes everything overnight. Your progress depends on many things. Your consistency, your lifestyle, your current condition, your ability to perform the exercises correctly. But when you have the right information and apply it consistently, you give yourself the best possible chance to improve. And if you feel like you need more personalized guidance, there are options available. Sometimes a general video is not enough. Sometimes you need someone to look at your specific situation, your symptoms, your movement patterns, your goals. That is why I also offer personal support options where we can discuss your individual concerns and create a more customized approach. During a consultation, we can look deeper into what may be contributing to your symptoms and what steps may make the most sense for your situation. Because every man is different. The exercises that help one person may need to be adjusted for another. Personal guidance can help remove uncertainty and make the process much clearer. I also understand that talking about pelvic floor issues, urine leakage, or sexual health concerns is not always easy. Many men feel embarrassed. Many men ignore these problems for years because they do not know where to start. But there is nothing unusual about wanting to improve your health. Taking action is not a sign of weakness. It is a sign that you are willing to invest in yourself. Your body changes over time. Your training approach should change with it. The same habits that worked when you were younger may not always be the best approach today. Understanding your body and training it correctly is what allows you to continue feeling strong, confident, and capable. So if you are dealing with pelvic floor issues, remember this. Do not just focus on squeezing harder. Focus on learning control. Strengthen when needed. Relax when needed. And give your body the time and consistency it needs. Small improvements repeated over time can create meaningful changes. Thank you for spending this time with me. If this video helped you understand your pelvic floor better, make sure you subscribe and stay connected for more evidence-based information on men's health, movement, and performance. And remember, no matter what stage you are in right now, keep showing up. Keep learning, keep improving. I'll see you in the next video.